Hi everyone, my name is Dinesh Sirasena and I'm a consultant in sports medicine. I use ultrasound regularly in my clinical practice and I wanted to share with you some of the lessons I've learned along the way so that you can also improve on what you're doing. Today we're going to be discussing about the transducer and its use in ultrasound imaging. As mentioned in a previous video, this is the transducer. Encased within the housing, we have the power cable, the piezoelectric crystals, which both emit and receive the sound waves, and various insulating structures. Each transducer will have different functions, and this is what we're going to talk about a little bit today. As I've mentioned in previous videos, the machine that's available to me in the clinic is the GE Logic S7 XD Clear. This machine carries 4 transducers, the curved, the hockey stick, and 2 linear transducers, as you can see in the image here. Let's consider the Curvilinear Transducer. It's got a frequency that ranges from 1 to 6 MHz and it's typically used for deep structures. In general ultrasound imaging, it's used for abdominal or pelvic scans, but in MSK, I tend to use it for hip and shoulder, particularly when I'm doing interventions and I need to guide needles into the joint or other structures surrounding it. Next, we have the hockey stick, which has a frequency range from 8 to 18 MHz. What this means is that it provides high-resolution images, but the penetration is low and can really only be used for superficial structures. Another thing to note about the hockey stick is that it's got a very small footprint, so it's really only useful for scanning focused areas. In musculoskeletal ultrasound, it's typically used for the hand, wrist, maybe the elbow, ankle or foot, and it can be used for scanning the joints, the nerves and tendons in these areas. Next, we have our high-frequency linear transducer, which has a range from 6 to 15 MHz. Now, as you can see compared to the hockey stick, this has a much larger footprint, and hence it's useful for larger areas, such as the hand, elbow, and wrist. It can also be used for the ankle. But due to the higher frequency, it's more beneficial to use this for superficial structures, such as ligaments and tendons. If you remember from a previous video, the better the resolution, the higher the frequency, but the lower the penetration. Finally, we have the linear lower frequency transducer, which ranges from 3 to 12 MHz. Again, similar to the previous transducer, this has a large footprint, so it's useful for scanning bigger areas. It's also better for deeper structures because of the lower frequency, and hence it can be used for muscles and tendons. Typically I use this one for shoulders, knees and hips, and it can be very useful for ultrasound-guided procedures as well. Just as an example of demonstrating why it's important to select the correct transducer for the area that you're scanning, I've imaged my wrist using the curvilinear, the linear, and the hockey stick transducer. Moving from left to right, you can see that with the curvilinear, the structures are not very clear, and it does provide a good area of view. However, we can't really assess the wrist very clearly. With the linear transducer, you can see things much more clearly. You can see the bones and the tendons, but you don't get the resolution and you don't get the accuracy of the images as we want. In contrast, with the hockey stick, you can see things very, very clearly and almost to the detail where you can see the fibers of the tendons. And so It's really important to select the transducer according to the area that you're going to be scanning and also according to the purpose for which you're doing the imaging. I hope you found the video useful and it adds to your knowledge of ultrasound and how you can use this in your clinical practice. If you did, please remember to hit the like button below, and if you want further updates, please remember to subscribe to the channel. I'll see you all very soon. Take care.